Hello. Welcome to the Supporting Dairy Workers Through Medical Legal Partnerships. I'm Rebecca. I'm going to go over just the basic of what a legal medical partnership is. I'm with Farmworker Justice. We're a nonprofit organization that seeks to empower migrant and seasonal farm workers to improve their living and working conditions, as well as immigration status, health, occupational safety, and access to justice. We work with farm workers and their organizations throughout the nation, and we're based in Washington, D.C. Next slide, please. So, a quick overview of medical legal partnerships. Medical legal partnerships, or MLPs, are the integration of legal and medical services to address the factors that impact health and well-being of patients and community members. They're especially important in farm worker communities because farm workers live because of their living and working conditions. MLPs empower workers to improve their health, living, and working conditions by connecting them with both health and legal services, as medical needs often go hand in hand with legal needs. This ensures a whole person approach to worker health and addresses systemic issues that lead to poor health outcomes. Um, a traditional MLP has legal services providers or a legal services provider at the health center. But due to various dynamics in rural communities, including distance to the closest legal service provider, health center relationships with employers, and funding challenges, MLPs in farm worker communities can look a little different from a traditional MLP. Other forms of MLPs in farm worker and dairy worker communities include referral systems, joint outreach, participation in organizations' board of directors, and cross-training on issues that impact workers. Today, we'll hear from Mary Jo Dudley, who will share research she conducted on medical legal partnerships with workers, medical providers, and legal service providers, and Maya McCann, who leads a medical legal partnership in Central Massachusetts. Mary Jo, I will turn this over to you. Next slide, please.
Thank you so much to Farmworker Justice and to the National Center for Farmworker Health for this invitation. As the chair of the National Advisory Council on Migrant Health, there's been a lot of promotion about exploring medical legal partnerships. So together with my colleague, Anthony Di Benedetto, and he's in the webinar as well, we wanted to explore this topic to see what we could learn from farm workers, their interest in MLPs, and to gain insights about best practices as well as constraints highlighted by existing MLPs. So just to reiterate what Rebecca just said, medical legal partnerships integrate the unique expertise of lawyers into healthcare settings to help healthcare providers and systems address the root causes of poor health outcomes as defined by the National Center for Medical Legal Partnerships. So, sorry about that. So as a broad overview, this is what we tried to do in our research because we wanted to explore how could this work to support farm workers we have three farm worker service providing clinics in New York State, and we wanted to explore how that could work in some of our clinics. Anthony, my colleague, is on the board of directors of Oak Orchard Community Health. I'm on the board of directors of Finger Lakes Community Health, and our third farm worker providing center is Sun River, and we've been in constant contact with them. So we started with a literature review, and then over the course of a year, we interviewed 194 farm workers. And these were semi-structured interviews with dairy workers as well as year-round fruit and vegetable farm workers. And we did this during visits of the Mexican and Guatemalan mobile consulate to various communities in upstate New York. This research was augmented with 15 semi-structured interviews with healthcare and legal organizations that currently have MLPs. And I know that these programs are extremely busy because it was very difficult to set up those interviews but we learned a lot. And then once the research was conducted, we analyzed the interviews, both with service providers as well as with farm workers to develop some policy recommendations. So from the farm worker interviews, there were certain things that jumped out immediately. There was the vast majority talked about their desire to have a work permit. This is a huge topic. Year-round dairy workers are not eligible for H-2A visas, so it's a heavily undocumented population, as are year-round fruit and vegetable workers. So we just shared a few excerpts. I want to have a status where I can come here and work and then go back to Mexico because my family is there. And um, one of the huge observations that we had is how isolation and fear experienced by undocumented farm workers can lead to mental health challenges. And we had many, many, many examples of that. We just pointed out a couple of them. The fear about leaving my home or being deported causes me anxiety, and I have been here for 15 years and made a life for myself here. And if I was deported, I would be separated from my family. And these interviews were conducted a year ago, and now with the current environment, this anxiety has increased dramatically. So some of the other um, topics that were repeated in our interviews with farm workers was these examples where sometimes the farm workers were unclear about what services they had access to. And so not only could we talk with them about their view of what would be the benefits of medical legal partnerships, but also in some cases we could help them to create support where needed. So my husband died on the way here, and I'm taking care of our son. I live at a church, and they give us food because I don't have access to benefits. I'm looking for work. So we had a large number of asylum seekers who were shipped from Texas to New York City and then bused to upstate New York. And so some of the people who are in that channel um, are still looking for work. Another worker said, I can't have full coverage health insurance as it's too expensive. I had to pay $7,000 when I went to the hospital. There should be help with this so that people can go to the doctor. No one wants to go because it's too expensive. And this really highlighted that some of the workers were unclear about how to navigate those large expenses. Being undocumented restricts us from doing certain things, like having a social security number, preventing us from getting health insurance and going to the doctor, getting medicine, etc. So we spend more money if we have to go to the doctor. And so part of after we did the research, there was a lot of education to link these people with the low cost medical support for farm workers. I broke my tooth and I couldn't uh, seek care because I didn't have health insurance. Um, we do still have a shortage of dentists who can serve farm workers, but trying to gather information and then share resources with people. So all in all, in these estimated 200 interviews, there were certain things that came out as benefits perceived by farm workers from MLPs, the primary one being cost. Free legal services through MLP will aid in overcoming the financial barriers faced by farm workers. The second is relevance, that the MLP service supports the unique legal needs of farm workers, including workers' rights, housing, and other topics. And one of the overriding themes that was repeated in our interviews was trust. Um, this sense of confianza, confidence, reinforces the trustworthiness of legal professionals. Farm workers described a greater sense of confidence in lawyers partnered with and vetted by trusted farm worker serving healthcare providers. Um, and convenience. And when we discussed the possibilities for MLPs, the farm workers highlighted the potential convenience of accessing healthcare and legal services in a single trip to the clinic. And they would often note that they have long work hours, that transportation barriers, there's no public transportation in rural upstate New York. So if they don't have a car, they have to pay somebody for a ride. But mostly the lack of knowledge regarding community resources. What kinds of community legal resources would be there? And comfort, that they expressed that they would be more comfortable accessing legal services in migrant healthcare centers where they receive culturally and linguistically appropriate care, where they know and trust the clinic staff and are familiar with the location and processes. So in summarizing what the workers said, they talked about these topics: cost, relevance, trust, convenience, and comfort. And they expressed the many ways that they could see advantages of MLPs. Um, and among them, uh, they made the connection between the availability of free legal services in the clinic to better quality healthcare services that would cost less money. Um, I think that one of the topics which came up in several cases is that if an attorney was vetted and could provide quality service, that they would already know the rights of the patients and the patients would receive better services. In terms of trust, and many of them said something in according to, if you trust your doctor, you would trust the lawyer as well. And this is a huge issue for undocumented population in particular. And again, it would be more convenient because there are more services in one place. And the comfort, I would feel more comfortable in a migrant serving health clinic, and it could reduce the stress of seeking legal services. And there was a huge question. They didn't know where they would seek legal services. So in our interview with medical providers, we also saw a lot of overlap in what people had to say. But primarily, they talked a lot about um, that there are benefits to the medical provider, and many of them are financial benefits, because it, uh, having legal services in the clinic actually decreased the appointment no-show rates, and they actually had significant statistics to back that up. And the medical providers said that just increased their productivity and healthcare uh, relevance. So there was a huge benefit where people talked about that if there were an attorney in the case where they have attorneys present, they can help address denied insurance claims. And in the end, that results in higher return money to the healthcare center, um, and really focusing on decreasing patient health harming legal needs. And so, all in all, that improves the patient's health. Um, and this is a benefit for the value-based payment and patient-centered medical homes that are part of many of the farmworker serving clinics in our area. So the medical providers talked about the availability of addressing patients' legal needs, resolving persistent patient health challenges. And so in they gave very concrete examples. If the patient is having respiratory challenges and the attorneys can address their housing issues, then their health will improve. And one of the things that came up over and over again was that the medical providers focused on the benefits to being able to treat the whole person and how that aligns with the Hippocratic Oath. Another benefit that was noted in our interviews was that if you have this partnership, it reduces community health worker and social worker efforts in trying to support patients in areas that are really outside of their wheelhouse, beyond their scope. And so having legal providers in the healthcare center actually helped decrease staff time of the CHWs, the community health workers, and the social workers trying to figure out questions where it's out of their scope of knowledge. So that was a benefit that was noted over and over again. So one of the huge challenges that came up in our interviews was the mental health challenges, right? And farm workers associated their legal challenges with creating stress, nervios, ansiedad, anxiety, nervousness, often resulting in physical health issues, including rashes, insomnia, and hair loss. So, treating the physical symptoms alone doesn't address the core legal challenges, whereas MLPs offer the possibility for exploring options for relief to address underlying legal challenges. And the other aspect of the mental health challenges that farm workers face is that many farm workers are very hesitant to seek healthcare services for mental health challenges, hoping to avoid being prescribed medications that may treat symptoms but not causes. And overall, there's an idea that if they went to a medical center and stated that they were having mental health challenges, that they would be referred to a psychiatrist. They would be given medicines. And over again, the farm workers would say things like, yes, I'm anxious, but I'm not crazy. Tengo nervios, pero no soy loco. And that's something that we heard over and over again. And we have heard over and over again in the past few years. So some of the observations for legal providers, again, this was an advantage for some of the legal providers who are always seeking funding to provide services for pro bono support for low income individuals. And they found that the MLP actually allowed them to diversify funding sources because it allows legal service providers to apply for diverse funding sources related to improving the health of special populations. So many of them commented on they would go for funding opportunities that they hadn't previously. Um, and so that was an advantage for engaging with farm workers through the MLP. And they gave us some examples. The breast cancer patient survivors address insurance denials related to breast cancer treatment, draft wills, and help patients access disability benefits. Also, the LGBTQ to address workplace discrimination, things like facilitating legal name changes, overcoming challenges to establishing probates, inheritance, etc. And many things were mentioned about farm workers, but one area that came up many, many times was to review the legality of pesticide exposure, and how that impacts farm workers. And when we talked about some of the things to really think about when establishing these partnerships, it was really important that there was an understanding of transparency regarding the level of representation. And so many of the legal partners from MLP noted their limited capacity to provide in-court representation and talked about it was important to be transparent about their capacity and also the scope of the legal support from the outset, because not all legal service providers can provide all types of support. One of the challenges that the legal service providers discussed was that it could be difficult to follow up after patients have left the healthcare facility. The access, and on the flip side, the access of to legal support in the healthcare facility was a huge advantage for people. But once they were released from the healthcare facility, it was hard to follow up for some of the attorneys. And I think the other thing that was really important for those initial conversations is that most legal services are short term or one and done. So they talked a lot about some of the services through the MLPs were drafting advanced directives, um, uh, repealing insurance denials, tenant advocacy, etc., and being clear that they can't help to sue any entity or file medical malpractice claims or any criminal or with any criminal law. Oops. So some of the things that were raised in our interviews with legal service providers was capacity, um, and how they would assess the feasibility of legal relief on a case-by-case basis and explain the process and options and refer to appropriate legal services for additional assistance if it's something that they couldn't do. They also talked a lot about assisting with completing workers' compensation forms, to ensure that farm workers start treatment right away. And if they can't complete it, that they will refer them to appropriate legal services for follow-up. A lot of efforts were dedicated to educating farm workers on housing legal protections, and to provide defense against evictions and educate or advocate with landlords or farmers for healthy living conditions in alignment with housing codes. And in the absence of culturally and linguistically appropriate health professionals in rural communities, MLPs offer specific opportunities to address farmworker mental health challenges influenced by legal cases. Whoops. So some of the opportunities for the future, the benefits for healthcare providers, MLPs provide financial incentives, payment recovery from denied claims, improve staff efficiencies among CHWs and social workers. MLPs decrease no-show rates. MLPs improve medical provider morale. And it's an improvement in treatment-resistant diseases for patients with legal challenges. And one of the things that came up many times was the increased reimbursement from value-based payment models, which use patient health outcomes as opposed to services rendered to determine healthcare provider reimbursement. So next steps, we have seen the processes that take place, and it's important to be able to discuss the pros and cons of MLPs with health center leadership. And at the same time, identify recurrent legal issues among patients so that you get the right mix. And in getting the right mix, when discussing this with legal service providers, they also need to find that where their specialization matches with the needs of the patients, but also where there are opportunities to fund the extra costs involved in here in having an MLP. And there's wonderful materials on for assistance on the Medical Legal Partnership website that would help people to get a sense of where to from here. I just wanted to mention briefly, because I know that this is part of a project of the avian flu project, that we have videos in Spanish and English language videos that were developed with a group of dairy workers from Alianza Agrícola and the New York State Department of Health, um, to give guidance on avian flu, what it is, how it spreads, what its symptoms are, and where to get health care, and how to protect oneself, and medical supports for those already infected with avian flu. This was developed in New York, but it has relevance for avian flu nationwide. So thank you for your time. Just want to end by saying it's ironic that those who till the soil cultivate and harvest the fruits, vegetables, and other foods that fill your tables with abundance have nothing left for themselves. This is such a um, quote. Um, so thank you so much.
Rebecca,
So
you're
sorry,
muted.
I was muted there. Thank you so much, Mary Jo. Now we're going to move on to Maya McCann. Thanks, Maya.
Thank you, Rebecca, and thank you, Mary Jo, for that incredible research. It's really cool to get that perspective from medical providers as well as farm workers about their experiences with medical legal partnerships. As we mentioned at the beginning, my name is Maya McCann. I'm a staff attorney at the Central West Justice Center, and you can go to the next slide. So, the Central West Justice Center is a legal services organization in central and western Massachusetts. And now that you've heard a kind of big picture idea of how medical legal partnerships can support farm workers, we wanted to give you like an on-the-ground example of how they might work, how a medical legal partnership could be set up, and then, provide an opportunity to answer questions. Um, so the Central West Justice Center has a migrant and seasonal farm worker project, which is a statewide project in Massachusetts supporting farm workers from the cranberry bogs on the Cape all the way to vegetable farms in the Berkshires. And we kind of practice in three buckets. We provide holistic representation. So that means um, eviction defense, wage and hour cases, divorce matters, pretty much everything except for personal injury or criminal cases. And more often than not, we have three, four, five matters open for the same person at the same time because that's just how the world works, right? We don't exist in a vacuum. We experience all of these different things overlapping, and we like to provide assistance to our clients as whole people. We also do a lot of community outreach and education because we have such a big service area and we're a small unit, a lot of driving around, visiting farms, getting to know workers and identifying need. We do a lot of know your rights trainings and spending time getting to develop relationships in the community. And we also engage in impact litigation and policy advocacy, which we'll talk a little bit about later. Next slide, please. So, one of the things about medical legal partnerships, as many of you I saw in the chat are part of these associations, is that they should be grounded in and informed by the farm worker community you're serving, right? And so I just wanted to give you a quick snapshot of who our service community is and how that led to our decision to begin a medical legal partnership in Western Massachusetts. So we have about 14,000 farm workers in Massachusetts in a variety of industries, including fruits and vegetables, cranberries, as I mentioned, and a lot of dairy farms. In the Commonwealth of Massachusetts, most farm workers are seasonal workers and domestic. So we really only have about 4% of our farm workers as H-2A workers. The rest and the vast majority live year-round in the Commonwealth and work on farms seasonally, with the exception of a few farms and industries like dairies that tend to operate year-round. But the vast majority of our farm workers live in communities, rent in the private rental market, shop in the same grocery stores that the rest of us do in Massachusetts. Next slide, please. Unfortunately, in Massachusetts, like many states, farm workers receive different rights under wage and hour laws than do other workers. And so this kind of was the impetus for a lot of the problems that we see in farm worker communities that we are trying to resolve with legal assistance and with the medical legal partnership. Specifically, in Massachusetts, farm workers have a sub-minimum wage, so they can be paid $8 an hour, which is 47% lower than our state minimum wage. There's no right to overtime pay, no right to a day of rest. And these factors, combined with other things like immigration status concerns, language barriers, isolation, contribute to significant rates of poverty among our farm worker community in Massachusetts. In fact, farm workers in Massachusetts experience severe poverty at twice the rate of other families and struggle with housing insecurity, food insecurity, and a variety of related challenges to health and well-being. Specifically, dairies experience really severe isolation. Most of our workers on dairy farms in Massachusetts live and work on the farm. And so they don't have a lot of contacts outside of the farm. Often their housing situations are really bad. And in Massachusetts, our farms are pretty small. So they fall outside of OSHA enforcement and lack a lot of other meaningful protections. Next slide, please. So we have this great project at the Central West Justice Center designed to overcome access gaps and really be like a community-based project. Unfortunately, we realized that we really weren't serving as many farm workers as we were hoping to, and we wanted to overcome some of the additional access gaps that we noticed in our provision of services. So we wanted to create a medical legal partnership. We'd had a long-standing relationship with the Bay State Brightwood Health Center and other health centers in the state, but there is something different about a formal partnership that is more effective than just a referral relationship. We talked a lot earlier about what a medical legal partnership is, so I don't want to spend too much time here, but I will just explain there's some really great resources you can see cited at the bottom and in the chat. And they can cover a lot of what a medical legal partnership is and can look like. Essentially, there are a variety of elements that a medical legal partnership can include. First, legal assistance. Mary Jo mentioned the example of a person who's struggling with respiratory issues based in a housing conditions problem that a lawyer can then address. Another common one that we see is patients presenting with inadequate nutrition because of an inability to afford healthy foods. In Western Massachusetts, most of our farm workers end up in really resource-deprived neighborhoods where they don't have affordable, culturally appropriate, nutritious food access. And so a medical provider, a nurse practitioner, might identify this as a concern, and the legal professional in the medical legal partnership could assist that family in, for instance, accessing food stamps or other benefits to help them afford healthy food when perhaps the income coming from the farm is inadequate. And this in turn can improve health and wellness outcomes for the family. Additionally, it is important that partnerships include these other aspects. Training is a really important aspect of a medical legal partnership that we have found. This includes the legal professionals training medical professionals on patient rights and resources. It also includes the medical professionals training legal professionals on health outcomes and the social determinants of health. And it also includes training of patients and the larger community on what their rights are, both in the legal sphere and in the health sphere. Medical legal partnerships can also include structural changes at the clinic level to be a more effective provider of services and policy changes. So working together using combined expertise to advocate for changes in the law that improve health and wellness outcomes for farm workers. Next slide, please. So when we start a medical legal partnership, there are a few things that are really important. So for folks thinking about how do we go about starting this, I wanted to include this slide. Mary Jo mentioned it. I will mention it again because it's very important. It is critical to build relationships and establish trust. Trust is such an important factor for farm workers serving organizations. And the addition of a medical legal partnership to a farm worker serving health center should not jeopardize trust, but rather should make should add to the trust. So it's important to be very mindful of that. Once you've built a relationship between medical and legal professionals, it's a collaborative process, working together to identify the critical needs in the community. For us, the number one concern that came up as we were discussing a medical legal partnership was housing. Housing insecurity is a huge problem among a farm worker community in Massachusetts. And so we knew this needed to be the number one issue we address in our partnership. You want to create a shared vision. What will this partnership look like? What are our goals? What is the capacity and scope? So our partnership, as you'll see, is limited to 3 issue areas. So it's important that expectations are clear. So we're not letting folks down, but also so that we can create a sustainable project. And then you get to the nitty-gritty. How are patients referred for services already? How can legal providers fit into that system's flow to lessen the burden and improve services rather than maybe making things more complicated? What privacy considerations do you need to think about? How will you communicate with each other? And then for agricultural facing organizations, there's some added challenges, right? One of the things I'm thinking of is many of our health centers who serve farm workers have these really great programs where they can bring a mobile health unit to a farm. For our really isolated farm workers in rural areas or on dairy farms, these mobile health units are lifesavers, right? Because they might not be able to leave the farm to access services. However, sometimes relationships between growers and lawyers are not the best. And we never want to jeopardize access of medical service providers to farm workers. So you want to think about how a legal professional can fit in without jeopardizing those relationships. In our case, it means I won't ever go to a farm with the mobile health unit. But the community health workers are going and they can identify when a referral is necessary and we can make it in a way that doesn't make a grower nervous. Next slide, please. You can skip past this one. So we have our medical legal partnership with La Cliniquita, which is at the Bay State Brightwood Health Center. As I mentioned, many of our farm workers in Western Massachusetts live in relatively resource-deprived neighborhoods, just as a product of low income and a high cost of living. What that means is most farm workers in our area live in one neighborhood, which is one of the poorest neighborhoods in the state. Fortunately, the health center is right in that neighborhood, so we're very accessible to the farm worker community. Our partnership involves, again, 3 buckets. We provide holistic legal advocacy through warm in-house referrals to an embedded attorney. So I'm on site once a week in the clinic, in the community health worker office, where I'm accessible by all the providers who identify a social need or a legal need and come to seek assistance for their patients. I do benefits, housing, and employment cases, and I can refer to others in my organization for things outside of that. We also do a training, Know Your Rights series, and train each other, as I mentioned. And then we engage in policy advocacy. So right now with our Farm Worker Coalition, we're fighting for minimum wage, overtime, and paid time off rights for farm workers. Next slide, please. So this medical legal partnership has been really helpful to us. In terms of the work for dairy farms, as I mentioned, our dairy farm workers are some of the most isolated workers in the Commonwealth. And the medical legal partnership has allowed us to reach them in ways we would never have been able to. For instance, I had a farm worker patient who worked on a dairy farm for more than 2 decades. And he asked for a day off to go to church with his family and was fired because there's no right to a day of rest in Massachusetts. Unfortunately, he was living on the farm with his family, and was told he must vacate immediately because his housing was a condition of his employment. Fortunately, he was able to connect with his medical provider who worked with me to support the farm worker We talked to him about his rights to a judicial process and helped him think through how he could advocate for himself with his employer, which he was able to do. And his employer allowed him to pay rent and stay there for some time while he figured out his next step. So the family never lost housing and never lost their connection with medical services, which was critical because he had a young child. Um, we also had another dairy farm case where a worker was injured pretty badly and was unable to return to work, who also was fired and threatened with loss of housing. But fortunately, they connected with us, and we were able to identify that, in fact, he was already a tenant under laws in our state, and help him assert a lot of rights, both on the employment side that had been violated and on the housing side. So he was able to remain housed for a year, get some money back from what was taken from him on the employment side, and move on to his next venture without any interruption. Honestly, I think one of the most significant outcomes of the medical legal partnership has been maintaining connection with medical providers. That is a big concern among medical providers in the farm worker community. And when we can keep workers housed and stable and employed, they're more able to continue their preventative care for themselves and their families. We also have avoided utility shutoffs so farm workers can cook, bathe, heat and cool their homes, and stay physically safe. I had a client who was about to lose her electric service because she couldn't afford the bill, but she had a son who had hearing loss and had to charge his hearing aid. And she was really worried about his safety navigating the home if they didn't have electricity. And we were able to fight off the utility shutoff and keep them safe in the home. We've helped clients obtain reasonable accommodations at work and at home, access public benefits and housing subsidies so that they can afford nutritious food, medical treatment, assistive devices. I helped someone get a guide dog. And then recouping lost wages and asserting their rights at work ensures that folks are able to, not make a decision between paying the rent and paying for medication, and that they're able to be physically and mentally safe when they're at work. And honestly, just feel dignified and respected. One of the biggest things that we're struggling with right now are workers feeling like, are workers being told by their employers that they don't have a right to sick time or feeling like they can't take time to use the bathroom. And so when we're listening to concerns of workers and responding to them with trainings about what their rights are, and able to maintain a follow-up with their medical providers who also really care about their outcomes, we keep the loop going and the family wholly supported moving forward. So the medical legal partnership has been wonderful. As Mary Jo mentioned, changes in the world sometimes make things harder. And I think the benefit of medical legal partnerships in those moments is that we can work together to strategize and adapt, to make sure that we're meeting the needs of our communities. And that's why that setup conversation was a circle, right? Because you always have to continue building relationships, maintaining trust, adjusting to needs, and making sure that the partnership is serving the community effectively. And then last slide. This just is a summary of what Mary Jo and I both said, which is that medical legal partnerships can really improve outcomes for systematically and structurally excluded populations. I can't think of a more systematically and structurally excluded population in Massachusetts right now. And the medical legal partnerships, as Mary Jo's research so well pointed out, can really be a game changer. Thank you.